Hello, everybody. I'm Jose Betancourt, and I want to talk about TBI, dealing with my brain injury and the road to recovery. I'm starting to use the word recovery a lot more because lately I've been motivated. It's been really tough trying to find that motivation. And lately I do have it. It all goes back to a dream that I had that I talked about where I dreamt of myself, that there were two versions of myself. Uh, the version of me in real life looking at a version of me in the dream, and we were talking, well, I was talking to myself in the dream. And then I interpreted that, the new me was teaching the old me how to learn and live and adjust to this brand new life that I have. So, anyway, I wanted to educate some people and not remind those who are dealing with similar issues, but do a little checklist and let's see how many of you have exactly what I have. So here I'm at a website, I think it's WebMD. It says what causes brain injuries. So here is some of the more common causes for brain injuries. Here is what caused mine. A blow to the head. I was hit with a 16-pound object from about 3 feet above my head. And when I got hit, I swore my eye popped out. It was really painful. Really, really painful. So let's move on. Uh, Causes of acquired brain injury include, let's see, thankfully, I don't have any of these: infection, poisoning, uh, strangulation, stroke. Thank God. I'm very fortunate. Despite having to deal with brand new uh, disabilities and having to kind of ignore what I used to do and, just work my way around it, I'm still very fortunate I didn't have anything really, really serious. So what are the symptoms of brain injury? How many of you have this? Cognitive, definitely cognitive. Perceptual, definitely. Behavioral, I mean, I think I have all of these. So let's move along. Cognitive symptoms of brain damage include, and follow me here because I know a lot of us have very similar symptoms. Difficulty processing information, yes, even though I'm getting a little better. Difficulty in expressing thoughts, not really. Difficulties understanding others. I have become less emotional and less sensitive to others, but I don't know if that's due to my injury. Yes, shortened attention span. It's really bad. Inability to understand abstract concepts. Yes and no, but I'm not going to check that. Impaired decision making, absolutely. Memory loss, hell yes. And then perceptual symptoms of brain injury. Of brain damage include, yes, change in vision, spatial disorientation, basically balance, inability to sense time, yes. No. Disorders of smell and taste, nope. Balance issues, yes. So I don't know what the hell I meant by this, but there is a lot of disorientation. Heightened sensitivity to pain, not really. And then, of course, here's the fun part. Physical symptoms of brain damage include Yes, persistent headaches, extreme mental fatigue. Yes, extreme physical. Yes, yes, yes. Thank God, no paralysis. Yes, with weakness. Tremors. Yep. And thankfully, no seizures. And then, absolutely, sensitivity to light, photophobia, sleep disorders, sleep disorders. Slurred speech has gotten better. Has gotten better. So, but I did have it. And sometimes if I'm not concentrating, I will slur. Or if I'm really tired, I will slur. I'm borderline slurring right now because I had vision therapy. So, pretty soon I'm going to take me a nap. But I just wanted to create this video so that there are people out there with symptoms that are real, that they might be ignoring, and they have no idea that they have some type of brain injury. And if you have any of these symptoms that I'm checking here, please see a doctor immediately. You don't want to be caught in a situation where, God forbid, you lose your balance, or you can't think fast enough, you can't process a situation fast enough, and you hurt somebody, or you hurt yourself, or even worse. So please pay attention to this video and take these symptoms serious. I get real tired of people telling me, yeah, sometimes I feel dizzy, or yeah, I forget stuff. That's not what someone in my situation wants to hear, because no, you are not going through what I'm going through, because if you were, you would be at a doctor and you would understand that you have something serious going on. So, yeah, we all kind of forget because we're not paying attention, or we are distracted. There's a difference between forgetting something that somebody told you to do because you weren't paying attention or you were distracted. And there's a difference between forgetting if you took your medication 3 minutes ago. I have to write it down. Every time I take my medication, I have to write it down immediately on my phone or on a piece of, on a notebook. Or forgetting if you took a shower or you brushed your teeth, or forgetting the day of the week. I mean, it's crazy. So anyway, here are behavioral emotional symptoms. Now, some people might have this regardless, but irritability and impatience, yes. Reduced tolerance for stress. You know what? I'm not stressed out, which is crazy. I should be, because there's a lot of uncertainty. But I'm not going to put that. Sluggishness, oh yes. Frightened or heightened emotions or reactions, yes. During the 4th of July, I thought I was going to go crazy. We actually went out to a beach so I could take photos, and I had no idea that everybody and their grandmother somehow got fireworks in New York City, and they were lighting it around me, and I swore that everything that went off was literally on top of me, and I was freaking out, and I was ready to just beat people up. Like, I kept telling my wife, let's go, because I'm going to go crazy and I'm going to kick somebody's butt. Uh, Denial of disability. Yeah. I'm still in denial that I have limitations. Increased aggressiveness. Yeah, I'm seeing a counselor for that. I've literally walked up to people and was inches away from punching them in the face for no reason. No reason at all. No reason. I just wanted to punch them. There was no particular reason why. So, yeah, increased aggressiveness. And I'm taking, a pill for that and seeing a counselor for that. And that was not there before my injury. How are brain damage and brain injuries treated? So, those of us going through it, we know what's involved. But anyway, I just wanted to do this video, kind of educate those people who don't truly know what's going on. And maybe some of my friends or relatives can see this and get a little bit of an understanding of some of the things that I go through, and those of you going through TBI as well, brain recovery, brain injury recovery, and stuff like that. So I'm using podcasting and video editing and audio and photography. I haven't gotten to that, but I'm using all of those creative processes to rehabilitate myself as well. So I'm on the road to recovery. I'm on the road. But anyway, I am Jose Betancourt. I thank you for watching my video. I'll talk to you soon.